Hello and welcome. In this video, I will be talking about how to get the most of that very short doctor's visit, as well as how to navigate through the system. And so this is about going to the doctor and trying to figure out your way. Say you get an illness, and now what? It's not as simple as it might seem at first. Okay, a disclaimer. I am not a doctor or a healthcare professional. I have worked as part of a healthcare team in a medical clinic. I did that for 6 years. And I'm also a patient with a medical condition that has proven to be quite difficult to diagnose. So I've been through that system. And I'm discussing that through that lens, some of the things that I have learned through working in the medical clinic as an assistant, and also being a patient, trying to make my way through the system that way. And also, this is my experience as a Canadian in the Canadian healthcare system. So if you're from another country, it might be different, but it's probably not all that different. Okay, if you have enjoyed good health up until now, which was my experience, I was very healthy up until just a couple of years ago, and then I got weird symptoms that seemed to just come out of the blue, and they were all over the place. And even though I worked in the healthcare system, and I was a little bit lost, trying to navigate my way through it. But if you also were struck with symptoms that you find hard to explain, and you're unsure if the symptoms even relate to each other, you're not alone. There's a lot of people suffering that way. And you go to a doctor's office, and you got 5 minutes, and you come out and you don't really feel like you had enough time to explain exactly what's going on, and you get a diagnosis. And so navigating your way through that, and navigating your way through trying to figure out what your condition is, and then trying to treat your condition, it can be a tough journey. You might have never had any interaction with doctors before then, except for the regular checkups and the regular blood work stuff. So, you have no idea what you're heading into if all of a sudden you get struck with an illness. Okay. Now you find yourself having to talk about your symptoms, right? And some symptoms might be vague, such as fatigue. Do you even want to tell your doctor you have fatigue? It's like, that was my concern. It's like, I don't even want to say to the doctor that I'm tired. Doctor's going to be thinking under his breath, like, yes, I'm tired too. We all are, right? But that could be a significant symptom. And if you don't tell the doctor, how is he or she supposed to know? But who doesn't complain about fatigue? Who doesn't have fatigue? It's one of those symptoms that we see mostly as an inconvenience, usually, like, I'm tired, like, it's hard for me to get through my day. But when it starts to interfere with your efficiency and with your day, and the things that you used to be able to do easily, you can't do because of fatigue, there might be something going on. And it'd be good to discuss that with your doctor. Yes, I am tired. And yes, I know that people are always tired. Everybody feels tired. But explain how it is affecting your life. And so, you might have symptoms happening, and something's wrong. And so you make a doctor's appointment, and you tell the doctor that you have pain and stiffness in your joints. So the doctor, maybe checks a few things in your, like maybe your shoulders or neck or whatever, wherever you're having the trouble. And then looks at your age and says, okay, 50 something, osteoarthritis. That happens a lot. It's happened to me, and it's happened to a few people that I know. It's like osteoarthritis. Which is probably true that you have osteoarthritis at that age, because that's wear and tear arthritis. There's not a whole lot you can do about it except kill the pain. Take a Tylenol usually. But your doctor cannot tell that you have osteoarthritis just by looking at you, unless the doctor has X-ray vision. So what do you do? You know, there's got to be something, right? I suggest these 5 tips, and these are just my suggestions, but I feel like they're fairly valid. So the first one, make a list of all your symptoms before you go to the doctor, like the day before. Make a list and write them down. Don't think that you can, and I even still do this sometimes, you know, it's like, oh yeah, I've got the list in my head, or I've got the things that I'm going to tell the doctor in my head. And then the doctor says something to you about something, you know, like about a symptom, or, you know, like a different diagnosis, or like a test they're going to send you for, and then it just throws everything out of your mind, and then you forget everything that you're going to say, and then you're looking, you're refocused and looking at something. It's like after you leave the doctor's, oh, I forgot to say this and this and this. Make that list before you go. The day before you go, make a list of any symptom that you have, like even if they seem minor and not relevant to anything. So, you know, so yeah, fatigue could be one of them. If you're feeling fatigue, any rashes, and I'm just gonna, I made a list here. Rashes, other changes in your skin, maybe you're itchy, maybe it's flaky, changes in appetite, either higher appetite, lower appetite, different cravings for different things, sleep differences. Are you sleeping too much? Are you not getting enough sleep? Are you waking up in the middle of the night, not being able to go to sleep anymore, and that's not normal for you? Changes in mood. Don't forget mood. Are you, you know, like maybe down, like feeling really depressed? That could be a symptom of something. And different kinds of pain include even headaches, you know, yeah, even if it's a mild headache, and if it's not something that you normally get, then include that in your symptoms. Or if something's getting worse. Changes in your eyesight, you know, like blurry vision, or, you know, like maybe you can't, your peripheral vision has changed. Hearing, you know, changes in your hearing, ringing in the ears that you never had before. Circulation issues, you feel like, you know, maybe pins and needles at the ends of your fingers, or they get cold easily. If you're feeling too hot or too cold, mention that. Palpitations, you know, like the heart, you know, feeling like your heart's banging. Cough, breathing difficulties, or different changes in your breathing, etc., etc., etc. Anything you could think of, you know, is your hair falling out? Anything like that. And I say that because there are so many little things that we think are just nothing, but they could be connected to a bigger issue, or the main reason that you're going there might be pain in your joints. But if that's a you know, something that you know, it could be connected to like headaches, and it could be connected to something else, because if it's an autoimmune condition, it can be just everywhere, you know, like who knows where the symptoms are gonna show up, and it's like it's weird. And so so don't assume that, you know, these little changes in your body are not connected to something bigger, or the main reason that you're going to the doctor's office. So that's step number 1. Okay, so a quick note, while it is good to have the information regarding your condition and symptoms, don't rely too much on Dr. Google. Don't try to Google your condition. I know a lot of people do that, but it can lead to a lot of anxiety. Okay, so number 2, don't be too quick to accept on-the-spot diagnoses. You know, doctors, you know, they have their patients, they want them to come in and out and in and out, in and out. And so they might be a little bit quick, you know, especially with the osteoarthritis, you know, that diagnosis. You know, if I had been quick, you know, accepted that quick diagnosis, then I would be treating my condition with Tylenol until my regular blood work a year later, because I had just had the blood work before that, and the doctor would have seen that my level of inflammation was sky high. And I would have been just taking Tylenol, which wouldn't have helped me at all. And same with a friend of mine who had rheumatoid arthritis, has rheumatoid arthritis, accept the on-the-spot diagnosis and just take Tylenol. Tylenol's not going to help the deterioration of your joints with rheumatoid arthritis. And so, you know, if you just accept that as true and just walk out, you know, and not think about it, then you could have a problem later on. And so, yeah, a doctor cannot tell, but just by looking at you, that you have osteoarthritis. And the doctor should be willing to discuss with you how they arrived at your diagnosis. If they did arrive at a certain diagnosis, maybe it is the right one, you know, if it's on the spot, yeah, I know what you have, then, you know, will be comfortable discussing that with you. And, you know, if you're happy with that, that's good. Then, you know, like take the treatment and run with it. But don't feel like you have to just accept that. You know, don't be shy about asking for different tests and say, look, this doesn't feel like it's just regular wear and tear. You know, can I be sent for some tests? The doctor should be open to at least discussing that with you. Okay. And next, if that's not good enough, if that doesn't work for you, you can ask for a specialist referral. Don't be afraid to do that. The GP is just that, a general practitioner. They are there to treat colds and flus and some of the other common ailments. But when it comes to something very specific, that's what we have specialists for. If your doctor is sending you for tests and blood work and is scratching his or her head and not really understanding what's going on and can't figure it out, then it's probably time to be asked to be sent to a specialist. And you can even do that before that. If you feel like your doctor is kind of struggling with the diagnosis or struggling with the treatment, then ask to be sent to a specialist. They're there for a reason. Okay, so number 4, get a second opinion if you feel like this isn't working. Even if it's a specialist or if it's your doctor, you know, that you get a specialist. The specialist might not work for you, or it might. So yeah, okay, so get a second opinion if you feel like it is needed. Your doctor or specialist has been treating you and maybe changing diagnosis and seems to be just kind of waffling on it and not really maybe knowing what's going on. It's okay to ask for a second opinion. I actually did that because I was diagnosed with a condition that turned out, you know, the condition kind of changed. And that happens. It was an autoimmune condition that I have. I still have it. And, you know, I was diagnosed with something called PMR. And then it was atypical PMR. And then it turned into PMR like illness. And, you know, it's like, you really don't know, do you? And so I asked for a second opinion. I went to a different rheumatologist. But one of the reasons that I did ask for a second opinion was because I didn't like the attitude that the other rheumatologist had. I just hated going to the in-person, especially the in-person appointments. I just dreaded it because he tended to look down on people, and I just it wasn't a good vibe that I got, and it shouldn't be like that when you go to a doctor. And so that's why I went to get a second opinion. And then when I did, I stuck with the new doctor that gave me the second opinion. And so, you know, it's okay to do that. And you would go to your family doctor to ask for, you know, can I get a second opinion on the condition that I have, and they should be able to do that. Okay, number 5, Keep all appointments, tests, blood work, and keep up with your treatment plan. Even if you feel like, oh, it feels like I'm getting better, don't change your treatment plan without working with your doctor or specialist. Okay, and thank you very much for listening.